Green Bay resident David VanderLeest is behind the recall effort. He has taken on recall efforts and Genrich in the past. 11 years ago, VanderLeest collected the necessary signatures to recall Democratic State Senator Dave Hansen. Hansen retained his seat, however, defeating VanderLeest, who ran as a Republican. A year later, VanderLeest unsuccessfully ran for the state assembly against Genrich. In 2015, VanderLeest also lost in the primary race to be Green Bay's mayor. Fox 11's Ben Krumholtz brings us balanced news coverage of this latest effort.
Speaking about the election,
Green Bay Mayor Eric Genrich has been under fire for issues involving 3 elections in the past 2 years. David VanderLeest says those issues are why he's registering a recall committee at City Hall on Friday. In a statement, VanderLeest tells Fox 11, under Genrich's watch, the city has suffered an election with only 2 voting locations, causing 3-hour waits, an election where Central Count had security issues, and an election where ballots were being counted without poll watchers, leaving thousands of city residents disenfranchised.
They let partisan outsiders take control of the 2020 election operations.
A commercial attacking Genrich with election-related allegations was recently released.
Green Bay Mayor Eric Genrich and the city council allowed this. Let them know April 5th that they betrayed our trust.
The ad is from Restoration, a political action committee out of Illinois. According to state data, Restoration has spent more than $60,000 on the ads and robocalls, plus another $23,000 on mailers for 6 city council candidates.
They're just putting a magnifying glass to everything and exaggerating. They remind me of someone yelling fire in a crowded theater while they're rubbing sticks together. It's just pathetic, it's sad, and it's really horrible behavior.
Alderperson Randy Scannell says the election with long lines in April 2020 should have been postponed. He also says there's no proof of the allegations related to the November 2020 election, and a public notice error for the spring primary in February was an unfortunate glitch. His stance is similar to what Genrich has said in the past about the elections. We asked Genrich for an interview or statement on the potential recall, but he provided neither. Scannell says he doesn't understand the timing.
It sounds kind of petty and desperate.
Scannell will be on the ballot next week, seeking another term on the city council. His opponent, Rob Miller, declined an interview request, but told us he believes the recall effort is ill-advised and won't succeed. However, he would like to see a bipartisan review of the elections. He says so far, all the reviews have been one-sided. If the recall is registered on Friday, like VanderLeest says, he'd have until May 30th, 60 days, to collect more than 9,700 signatures. That's 25% of the amount who voted in the last governor's race in Green Bay, which is the requirement to trigger the recall election.
Why do you think that we're seeing a slight uptick in cases?
You know, anytime we see cases go up or down, there's always a lot of reasons we experience that. You know, part of this equation probably is that there is a new variant that's floating around that potentially is a little bit more easily transmitted than even the Delta variant and then the Omicron variant that we had those pretty significant increases over the last few months with. Additionally, with cases being low, people have let up a lot of the precautions that they had been following and loosening up a little bit. And, you know, in addition to spring travel and many other variables, that's what's leading to this very small increase in cases right now. You know, our positivity rate is up just a little bit over the last week or so, and case numbers are up very slightly as well. But hospitalizations so far have led relatively steady. You know, we have about 20 people in our hospitals in northeastern Wisconsin, and that compares to well over 200 when we were sort of in our peak over the fall and middle of the winter.
Well, that certainly sounds like good news that the numbers in the hospitals are down. Earlier this week, another booster was approved for those 50 and older. What's your advice if people don't want to get it?
You know, it's a great type of question. You know, I think there's people who have sort of decided that they're not going to get vaccinated. I think there's probably not a lot of people who are sort of on the, you know, edge of that decision at this point. But, you know, if anyone has questions about their vaccine, I think the best person to talk with is with your personal physician or your primary care provider. You know, that type of relationship in discussing risks, which are very small with vaccination, and, you know, benefits which we have experienced really significantly, even in our own health system, where people who are vaccinated have about a 10 times less likely chance of needing to be hospitalized and getting that sick, in addition to less likely even catching COVID in the first place. You know, clearly the benefits continue to outweigh risks of vaccination, but the person I think to talk to who would be best would be the primary care provider.
And for those who already know that they want it, should we stick with what we've gotten or mix and match? For example, if we've gotten Pfizer all along, is there any benefit to switching to Moderna's vaccine?
There is some theoretical benefit about changing up the vaccine to give your immune system a little different experience than it had the last time that you had been vaccinated. I stuck with Pfizer for my booster shot. I'm not over 50, so I'm not eligible for this fourth dose, but maybe we will see those recommendations change at some point in the future. But there is some theoretical benefit to changing it up. I think people can sort of choose what they would like to do, or you can continue to continue the sequence of what you've already had.
Recent testing showed an increase in the virus found in wastewater. What does that mean, and why is it important?
This is sort of an interesting thing that's been studied, really particularly here in Wisconsin, where they're looking at wastewater and how many copies of the virus they can find in, essentially a sample of our wastewater. And they correlate this with what our experience is with cases in our community. And it can sort of serve as an early warning signal where we start seeing wastewater treatment levels rise before we see people seeking those tests to see if case numbers are rising. So it's a great surveillance tool that we have going on in our state.
Nationwide flu cases are up. Why is flu activity climbing now? It seems late for flu season.
We saw a little bit of a hump with the flu cases going up, seems around December of sometime last year. And cases do seem to be climbing up a little bit once again. It's not as aggressive as a flu season that we have experienced, I think, several years ago. But we do see relatively high cases of flu for what we typically experience this time of the year. Again, the exact reason for that isn't entirely clear. Could potentially have something to do with, again, people not wearing masks as much as they had earlier in the year, where it's giving the flu the opportunity now to spread more easily from person to person, resulting in those increased numbers within our community.
Doctor, I'd like to get your thoughts on this. How are you feeling 2 years into the pandemic? Is morale better? You said the numbers are better. How are we doing? How are things around the hospital?
Yeah, our case numbers are really low in the hospital. After having over 1,600 people hospitalized with us since the pandemic started, which is a lot of people to receive care in an inpatient setting in a hospital. For the last several weeks, we've had maybe 0, sometimes 1 person in the hospital with an active infection of COVID-19. And that's much easier for us to care for and, scale up operations to provide care to, maybe just 1 person from time to time. And people seem to be less sick, probably for at least the last month now, where people do not need intensive care level. They're not really sick, and it's not, people aren't suffering with COVID-19. So, I think people are doing really well in the healthcare setting at this point. Obviously, hospitals are still very, very busy with people who may have delayed care during the COVID pandemic. And we just have an aging population, in the entire country as baby boomers get a little bit older. So there's a lot of people who need care as they get older. Thankfully, right now, COVID isn't as big of a burden as it has been, and I'm really hoping that it continues to stay this way. I think it's very unlikely we'll go back and experience what we did during Omicron with that really significant surge, as so many people have some degree of immunity, either from vaccination or from being infected previously. But I think things look relatively good for us, even in the short-term future.